there, I'm Kelly Dean from the Tummy Team. I'm a physical therapist and a core rehab specialist. We specialize in all kinds of conditions that affect your core muscles and specifically address diastasis recti. Diastasis is a separation of your abdominal wall that happens at the connective tissue that runs right down the center where it gets overstretched or damaged. A lot of times people overlook the hormonal influence in getting a diastasis or trying to rehabilitate a diastasis. And we're going to talk a little bit about how hormones play a role in that. First, you need to understand that hormones are the chemical messengers in your body. The way your body communicates from certain glands to organs and back from organs up to the glands. And we have lots of different glands that produce lots of hormones. There's hormones running through your body all the time that help you function well. There are specific hormones that have a specific impact on connective tissue. And since connective tissue is involved in how the diastasis develops, because it develops at the connective tissue level, it's important to understand those specific hormones. We're going to talk about several of those hormones, recognizing that this is just a piece of what's going on usually when people develop a diastasis. There's a lot of other contributing factors that we talk about at the Tummy Team and that we have functional rehab programs to help with, but we wanted to make this video specifically addressing the hormonal issues that are sometimes playing a role in your healing process. So the first hormone we're going to talk about is cortisol. Cortisol is released by your adrenal glands. It is a steroid, and it's natural in your body. It's in your body every day. It goes in cycles throughout the day. It affects your sleep. It affects basic life functions. It is also called your stress hormone, which means that when you're under chronic amounts of stress, it increases. So stress and strain and worry is not just being a worrywart. Stress and strain and worry sometimes can be just being stressed out, but also can be having putting your body through a lot of stress, like a competitive athlete or an intense fitness program where you're constantly pushing your body past its limits causes stress, and that increases your cortisol level. Other things like a new baby, not sleeping well, lots of new stressors with the baby, also just stressful life and work environments. Anytime your body is under a long-term amount of stress, the cortisol levels rise in your body. That's not great. Increased cortisol levels affect a lot of things, from your immunity to just your circulation, all sorts of things that are going on, but specifically to connective tissue. When your body has high levels of cortisol, the cortisol starts eating connective tissue. It starts to break down muscle, bone, and connective tissue, including ligaments, and causing damage to that particular, those particular structures in your body. It does this because it's looking for an alternative food source, sugar, to feed the brain that is on overdrive. So when you look at high stress levels in your life, that cortisol level being high impacts the connective tissue. And how this affects somebody with a diastasis is it really breaks down the integrity of the connective tissue, specifically in the linea albia in this case. So a lot of times what we'll see is some of our clients that have really histories of really competitive sports or intense fitness routines are clients that have more severe diastasis or more likely to have a diastasis because they've damaged that connective tissue from constant high cortisol levels. Other clients that we see like this are people that are under a lot of stress for a long time, maybe consecutive pregnancies, maybe really difficult babies and seasonal changes. All sorts of things like that can contribute to you living with that high level, and that directly impacting how the connective tissue responds in life, but in function too. So what's the good news? The good news is awareness first. First, you need to understand that stress does affect your body negatively, and it keeps your body from healing, and it contributes to damage in muscles and in connective tissue and in how your body works. So awareness is the first step of healing. It's the most important step because if you don't know what's happening, you keep doing it inadvertently. So first you want to look at how can you address some of the stressors in your life. You want to recognize that even small things like deep breathing, journaling, prayer, meditation, gentle stretching, and kind of just addressing some of the stressors, getting, reevaluating your sleep routine, giving yourself some time to unwind at the end of the day. Between 8 and 10 p.m. is a natural time that your cortisol levels should dip. This is not a time to watch a stressful TV show, to go through your finances if that's stressful. You want to allow yourself to unwind and get that natural dip in that cortisol level. There's a lot of other things that can be helpful. Magnesium, vitamin B, vitamin C. There's a lot of things that can help start to normalize that cortisol level. But remember the communication. The gland is sending hormones, chemical messengers, to react to something your body is telling you. Your body is saying, I'm really stressed out. I'm really always pushing myself. So the adrenal glands are constantly trying to meet that fight or flight challenge. If you start changing the signal up to the adrenal gland responds differently. Okay, so looking at how your body is talking to itself and recognizing that high intense fitness practices are not always what you think they are. And powering through life does not always work out best because there is a chemical reaction that is affected by that. Okay, the second group of hormones we're going to talk about are estrogen and progesterone. And these are the two primary female sex hormones, right? Men have them, but it's mostly females that have big quantities. And then we have a natural cycle throughout the month. Estrogen is released by your ovaries. Both estrogen and progesterone are released mostly by your ovaries, and some from the adrenal gland, and then also from the baby or the fetus or the placenta when you are pregnant. But when you're not pregnant, just on a typical 28-day cycle, your estrogen kind of spikes right at day 14 for ovulation to occur, and then it drops down, and then it raises up again around day 25. 26 at the cycle, okay, right, and then it drops off. If you don't get pregnant, it drops off right before you start your period. This natural ebb and flow happens every month. When estrogen is high in our body has increased laxity in our connective tissue. There's a lot of theories about why this happens, but ultimately their thoughts behind it are that it helps for the egg to release, and it helps to prepare the uterus for implantation. But estrogen is going through your whole bloodstream. So even though it's trying to affect those two areas, it also affects a lot of other areas. And this is the time that it seems that people have, especially women, have injuries during those kind of peak estrogen times. The other thing to think about is progesterone. It naturally kind of starts after ovulation, and it naturally starts to go up, and it also peaks at about day 25, 26 in your cycle. And so now you have a perfect storm of these two hormones that are pretty high. Progesterone is often called your relaxing hormone. It relaxes a lot of things in your body, and not just in the menstrual cycle and in your kind of reproductive organs, but throughout your body. So it is raising too. So now we have this perfect storm right in that premenstrual time. This is time when people have a lot of back pain. There's other things that contribute to it, but part of it is there's laxity in the ligaments and the joints around the pelvis, and that laxity also can present in the connective tissue of the linea albia in a diastasis situation, okay? So when you get pregnant, if you get pregnant, progesterone continues to rise throughout your pregnancy. So now you're keeping a level of hypermobility throughout the pregnancy. What you need to know in terms of diastasis is there's a normal ebb and flow in what's going on typically in every month. And there are certain times that your connective tissue is more vulnerable to stretching, damage, and injury than other times. So around day 14 and around day 26. To be general. Those two times you have an increased hormonal influence that increases laxity and vulnerability to the connective tissue. That increased vulnerability and laxity will also make your diastasis seem deeper or wider if you check at those times. So understanding that understanding this awareness again is a key piece. Like, the good news is recognizing that now I know, oh, I'm not going to check my diastasis at 14 or day 26. Oh, this makes sense that my diastasis seems a little bit worse, or my tummy seems a little bit more distended at day 26. It's understandable, and you don't overreact to the normal ebbs and flows of the healing process and of your body if you understand what's going on at a chemically and a hormonal level. The other thing to be proactive is to choose what exercises and activities you're doing at those times in your cycle. These might not be the best times to do your heavy workouts, really intense working out, and doing maybe intense lifestyle things. Giving those 2 days or 2 little stages in your cycle to be a little bit gentler with yourself will prevent unintentionally causing more injury and more damage. So those are some things to think about with diastasis with estrogen and progesterone. Now, the third kind of hormone, it's actually the fourth hormone we're going to talk about, but the third grouping is relaxin. Relaxin is primarily a woman hormone. It is in men, but it doesn't circulate through the system. It just stays within like sperm and semen. And it's basically to get to the woman to help the sperm to get to the egg. But in women, you actually have relaxin in your system every month, and it starts along with progesterone. After ovulation, it just has this gradual increase towards that day 26. Day 26 now is even more of a perfect storm, because now you have estrogen elevated, progesterone elevated, and relaxin elevated. So that premenstrual time, you're not losing your mind when you feel like everything's kind of loose and all over the place and you're feeling really kind of disconnected from your body. There's a lot at a chemical level going on to make you feel that way. Now, relaxin also, when you get pregnant, just really elevates in that first trimester. It's highest in the first trimester. And the reason is that relaxin does what the name says. It actually relaxes parts of your body. It relaxes the uterine wall to allow implantation and to protect the fetus so there's not excessive contractions that would cause a miscarriage. It relaxes the blood vessels so that it increases blood flow to the belly and to the baby and to develop the placenta, and increases the laxity in the blood vessels in and out of the kidneys. But it also relaxes muscles and connective tissue to allow for the growth of the pregnancy, the growth of the uterus. So it specifically relaxes the linea albia to allow for the uterus to grow, and it specifically relaxes the ligaments in the pelvis to allow the pelvis to expand for delivery. So that first trimester can sometimes really make bellies pop, because the relaxin allows everything to relax really quick all at once. So if you are in your second pregnancy, or if you are somebody that had a previous diastasis, that first stage of your pregnancy, you're like, oh my gosh, I thought my diastasis was better. Well, it may look worse right then, but don't panic. It's just because you have so much extra laxity in your ligaments at that time. Your relaxin level will balance off. It's still elevated, but will kind of level off in the second trimester. And then in the third trimester, it gradually increases again to really peak right around delivery, to really let everything expand, and to allow the membranes to rupture, for the water to break and the baby to come out. So there's also a lot of relaxin at the end of your pregnancy, which can cause your diastasis to look worse, or for muscles or joints around your pelvis to be very unstable. And then relaxin stays in your system for several weeks to help with milk production, and it will remain at a certain level, kind of an elevated level, not as much as pregnancy, but an elevated level throughout your anytime your lactation process, for as long as you're nursing, basically. So relaxin and progesterone stay in your system until probably about 3 months after weaning your baby. Okay, so how is this valuable for diastasis? First of all, knowing that there are 3 hormones that are causing joints to be very lax, and connective tissue to be very lax, that compounded with the growth of the uterus and the pushing out, not to mention most people are going in with an imbalance between the internal and external muscles, collapsed postures, poor strategies of bracing their tummy, holding their breath, bearing down, and tensing up and pushing out, not to mention poor fitness choices of crunching and bulging the tummy with strain. All of those things together are a recipe for diastasis recti. This is why diastasis is so much more common in women, specifically childbearing ages of women, than it is in men or women of other ages or children or different things, because that kind of trifecta of the hormones and the expanding belly from, a growing uterus. So what you need to recognize is it's really healthy for you to have these levels of relaxin. Your body needs them to have a healthy pregnancy and delivery. But you also need to recognize there's something different going on in your body, and to treat your body in physical fitness and in activities as if you aren't pregnant is really irresponsible. It's not taking into account the fact that there are some legitimate changes going on that make your body vulnerable to injury and damage. So how we address it is, what's really cool is there's a ton of stuff you can do prenatally to strengthen the muscles and to work on alignment, to not add any additional stretch to that connective tissue, and to reinforce with muscle and alignment and strategies to use the muscles most effectively to kind of take up the slack, so to speak, of those weakened ligamentous and connective tissue structures. So the muscle work is super important, and then also training those muscles for delivery, so that in that really intense cortisol high stressful delivery, you aren't inadvertently pushing out and pulling apart your abdominal wall to get the baby out. We give you strategies to do that well. And then post-baby, Core Foundations helps you to systematically pull everything back together so that parenting postures and things you're doing in your everyday life of a mom and taking care of your kids are not also compounding and impacting the way your body's going to heal. So understanding what's going on and being proactive about fitness choices, lifestyle choices, and rehab and core strengthening is going to really make a world of difference in how your body responds to a diastasis, whether it even gets one, and how you can heal it. All right, so all that being said, the last thing I want you to think about is most of our clients have all 4 of these hormones playing a role. Most of our clients have a certain amount of stress in their life, are powering through life and living at very high cortisol kind of producing levels. Their hormones are also in their menstrual cycles they're not respecting the normal flow of what's going on, and they're not respecting what relaxin is doing in their body, and they're not taking into account how to be careful and intentional about the things they're doing. So inadvertently, just going through life, they're doing things that are hurting themselves, and it's easy to change. Now, like I said, I'm a physical therapist. I'm not an endocrinologist. I'm not a naturopathic physician. Hormones are not my specialty. However, what is our specialty is looking at how the whole body works together so that you can be strong and functional and successful and strong for the life you are meant to live. And understanding some basic just knowledge about how the hormones play a role in that process can be really helpful for you to not get frustrated, to not be irritated by certain things that are absolutely natural and necessary for your body to function well. Okay, so I hope this helps clear up some of the kind of maybe misunderstandings or just lack of knowledge about how hormones influence your rehab process. We would love to help you. check out more at thetummyteam.com. Also, follow our YouTube page, our YouTube channel. We have lots of videos on there. Follow us on social media. We have lots of helpful tips there. And then check out our online programs. If you're local, come and see us here in Camas, Washington. We would love to work with you in person. But if you're not local, we have online programs that are super effective, as well as Skype follow-ups to, work with you one-on-one. We would love to help you be strong and heal your diastasis and understand fully what's going on in your own body. All right? Thanks so much.